Yes, it is.
Right?
Yeah.
And I couldn't not talk about this because I guess a lot of what we spoke about last time was about nutrition.
Yeah.
Through kind of, our menstrual cycle. But are there more times when we're more insulin resistant during our cycle? And if so, how should we be looking at that? Because I think it's important to talk about because I don't want people to become scared of not having carbohydrates.
Right.
So how should we be looking at this for oneself?
So this comes to the ovulation standpoint.
Yeah.
Because after ovulation with progesterone, like I said, progesterone is catabolic.
Okay.
Its whole goal is to provide the building blocks for endometrial lining. So it is preventing a lot of the carbohydrate and glucose from being uptaken into cells that are not part of the endometrial lining. So we have a little bit of insulin resistance there. For the general woman who doesn't have any undercurrent of metabolic syndrome or diabetes, it's not a big thing.
Okay.
Because if it was, we wouldn't be here, right? There would be, an evolutionary change that would have wiped out humankind. So if you're generally healthy and you're active, it's not a big thing to worry about. If you have metabolic syndrome or you have prediabetes or full diabetic, then it's something to consider within your treatment and understand that, yes, you have more insulin resistance after ovulation that exists until your next bleed. So you have to time carbohydrate according to physical activity as well as when you are using your insulin.
Okay.
So it helps with insulin control in those clinical situations.
Okay. But the normal woman that's training maybe 3 or 4 times a week,
she shouldn't worry about it.
She doesn't need to overthink.
No. And the reason why it's become such a thing is because of continuous glucose monitors being used in a healthy population.
Well, I was about to ask your opinion on that.
Yeah, I know. So I look at it as one of my PhD students just finished doing a longitudinal study on ultra runners using CGM to determine fueling during ultra runs. And there's definitely a change across the menstrual cycle with the way your body uses glucose and how your body will use it during training. Does that impact what they should be doing? When we find out, no, actually, you can have a low amount of carbohydrate intake as long as you have an elevation in blood sugar, your body's going to be fine. So when we look at continuous glucose monitors and people are using, going, oh, I can't have oatmeal because it makes my blood sugar spike. It's like, well, yeah. Anything that you eat is going to bring blood sugar up. But the continuous glucose monitor isn't monitoring blood glucose. It's monitoring interstitial fluid, and there's about a 20-minute lag period. So people are freaking out about the actual notes that happen after each kind of food that they eat. Really, if they're worried about it, they should look at trends over time.